progress is important, and they're identical. When I don't,
Even in this bout of recovery, you get to real stories, real recovery. I am Kat, and I'm on the road of recovery.
My name is Kristina. I am the harm reduction manager at Canton City Public Health, so I run our harm reduction programming there.
Thanks so much for coming out and joining us. Could you talk a little bit about what brought you into this field, how you got started working in this area with people with substance use disorder?
Okay, so I actually grew up in a small town. I moved away when I was 17 because my family had their issues with substance abuse. So I was sick and tired of seeing people suffering from substance abuse disorder. Moved away, went to college, got my master's in social work, realized that I wanted to do something in the field of addiction, but more non-conventional than what most would think of for a social work person. So yeah, because of my personal ties and the losing family members and all of the trauma that comes along with that, I've put that passion into our harm reduction programming that we have here.
Very cool. So can you talk about what you have done personally to be healthy, to be able to run a program like you do?
Oh yeah, it was definitely hard at first. It was hard getting into the syringe exchange at first. I'm an only child, so both parents had their issues, and yeah, it was a lot of chaos, a lot of stuff I shouldn't have seen as a kid, but I had other family for support, and spent a lot of time with them, took care of myself. After I went and moved away at 17, the being independent and trying to learn and figure things out on my own really made me push through. And then the more I learned about substance abuse, the more I felt like a bad person for having that resentment towards my family. But that education is such a huge piece for me. I've learned a lot about substance abuse and put it together with my own personal experience. And yeah, that's where I am
Very
today.
cool. Yeah. So, and I do think that education piece, because when you're a kid and you're in it, and you just want your family members to
be okay.
to be well, and understanding that it's a disease, and that that there is help that people can get, it makes all the difference. And
Yes.
And realizing that you were just a kid that wanted their mom and dad.
Mm-hmm.
So how long have you worked for the health department?
So I've worked for the health department for about 3 years. I started off as the early intervention specialist there. So I was doing HIV prevention. And part of that HIV prevention was the SWAP program. So I did work SWAP straight from the beginning. And like I said earlier, it was difficult at first because I was in a relationship with somebody that, was still in active use. So my feelings were like all over the place,
right?
And like being okay with it.
And what is the SWAP program for people that don't know?
Oh, our SWAP program is a syringe exchange program that we have here. We run it 3 days a week now. We offer HIV Hep C testing. The whole purpose of the program is to prevent the spread of infectious disease. That's how we're able to run our syringe exchange. So we offer the Hep C HIV testing at their rapid tests. The person will leave with their results that day.
That's awesome.
Yeah. We have a DIS, which is a disease intervention specialist that's on staff too. So if somebody were positive for HIV or Hep C, we would be able to link them with an appointment before they even left the building.
Wow.
Yeah. We also have injection-related wound care. So we have a nurse practitioner that's on staff that is able to prescribe antibiotics, debride the wounds, and, do the things that are necessary. We provide like wound care supplies. Mm-hmm. So we have like the Band-Aids, the gauze, the antibiotic ointment, all of that stuff that we give each participant. But the wound care nurse is amazing. So we also have Ohio Can, which is a local grassroots agency here in Ohio. We have a volunteer that comes in every Friday that makes grilled cheese sandwiches for our people, which is amazing. Our people love it.
Yes.
I mean, this population, we know sometimes doesn't get food, a hot meal. So a lot of our participants look forward to having that there. What else? So we have a peer support person there on Fridays. They're able to, if somebody's interested in getting into treatment, these people are the point of contact for getting them into detox, getting them into an inpatient, outpatient, whatever the person's interested in. We have resources come in every Friday too. So we have like SARTA, which is our local bus transit. We have the Goodwill, which is able to link people with like job readiness, job stuff. We have the insurance companies coming in. So we have like CareSource and Molina. They come in and talk about like all the benefits that most people miss out on with their insurance plans.
Right.
We have legal aid come in. So Stark County Legal Aid comes in once a month, and they don't do anything with criminal, but they do like any evictions, child support stuff, get your license back, like all the things that can help this population.
Right. Absolutely. Yeah. Well, and not only, I mean, part of the work that you're doing is treating people with dignity, which is, fantastic. The other piece that I think people that aren't in this field don't realize is the cost savings by giving clean needles versus having to treat somebody with Hep C that, typically it's $100,000 to be able to go through and treat that for one individual versus the cost of, clean needles.
Right.
Also, when you were talking about the being able to care for the wounds, being able to teach people how to care for themselves, but also having that specialist, the burden that we have seen on the healthcare system and the amount of expense, because that person's going to end up at the emergency department if it doesn't get addressed at the clinic. Yes. So, or may end up and
we try to not to not get them there because we know how our population is treated within the hospital system. So they're going to be sitting in the waiting room for 2-3 hours
at least.
Right. And once they get back there, how are they going to be treated? It's just our population does not like going to the hospital at all.
Right.
So, yeah.
Yes.
I mean, we encourage it. Obviously, if it's that bad, we want you to go.
Right. Yes.
Yeah.
But if you can go through and have a nurse that's being able, that is trained to work with this population and not having more shame or guilt on the person, that's incredible.
It's huge.
So as taking over this, can you talk about any tweaks that you have made to the project that you have seen success within the harm reduction? Yeah.
So previously we were only doing swap on Fridays for 2 hours. So since
pretty limited time,
it's very limited, and we know our people schedules are literally all over the place, just like any person's schedule is all over the place.
Right.
So we were able to create some walk-in hours on Mondays and Tuesdays so people can come in during the day. And it's pretty much all day. So it's not the full clinic experience with the grilled cheese and the nurse and all the things, but they are able to come in and dispose of their used syringes and get some clean.
Which that makes such a big difference, because we know that this population, if they don't have the right utensils, they are going to continue to use with dirty needles.
Which you have the risk of infection, you have risk of people sharing equipment, which there's where the HIV Hep C comes in. There's just a lot of things that can be avoided.
So that's incredible. So what are the barriers that you still see that are out there that you guys are, big picture, small things, but if you could talk about where some of the struggles that you still continue to see in this.
So one of the biggest barriers I think I see is within the hospital system when individuals are going through withdrawal. They're not always treated great in the ERs. They're not always treated for the withdrawal symptoms in the ER. A lot of our people will leave, like AMA, say somebody's in there for a pretty severe wound and they're waiting forever and ever and ever. They're going to get sick. They're going to leave. I think in my brain, I see a solution as MAT and the ER having people trained on like anti-stigma, like language and how to, you know what I mean? Just
Absolutely.
basic human dignity. Not to say our hospital systems aren't doing what they're supposed to do. They're overwhelmed, and I understand that. I'm a big advocate for our people being treated like they should be treated.
Absolutely. When I think that piece of the MAT, the initiation for what many years the doctors had to take an additional class and hours and whatnot, and we've done away with all of that. So any doctor with a DEA number can write a script for being able to initiate somebody on to MAT that allows somebody to not feel those terrible withdrawals and whatnot. So as the health department, are there thoughts or plans of being able to work more with your hospital systems?
Yes. So we've actually had a couple meetings there is a program that was funded through the One Ohio grant at Alban Hospital that does initiate MAT in the ER. But there's so many, we've met with that person and there's just still so many kinks to be worked out because it's such a new program. But we are doing an anti-stigma training. So we're working with the Opiate Response Network to create an anti-stigma training for nurses, physicians, pharmacists, all the people in the ER, EMS staff. So I think for me, and I'm going to sound like a broken record, but that education piece, what people don't know, they don't know. And what people don't know, oftentimes they're scared of. So I think us getting education out there is the best thing we can do.
What can you share, and maybe that not that directly that you're doing, but programming that you have seen that has been helpful for on the prevention side and what the health department's doing?
I mean, we're all about the treatment. I would never push treatment on any of our participants, but we have so many options available for them when they're ready. As far as prevention, like we offer HIV prevention. So we have an early intervention specialist took my spot. So she's able to get somebody linked with PrEP, which is a medication that you can take every day to prevent HIV. So in that aspect, we're mostly focused on the health and reducing the spread of infectious disease.
Absolutely. So as a person who has, personal experience with family members and working in the field, are there 2 or 3 things that you could recommend that are helpful for people caring for themselves as they're, navigating this, somebody that has a loved one that has a substance use disorder?
I mean, I've been there. I know what that's like. And you've just got to take it one day at a time, just like somebody that's in recovery. You've got to take it one day at a time. I know when I was younger, Al-Anon and Nar-Anon, just having that support is huge. You have support, you have somebody to talk to. Never give up hope. Hope is always there. That's a whole part of our harm reduction program. Hope is there. I would have wanted these types of programs for my family back in the day.
Absolutely.
I mean, there's always light at the end of the tunnel. As long as you keep going towards it, you're getting somewhere. And it doesn't matter how small the step, at least you're making the steps.
Absolutely. Yeah. Well, thank you again so much for coming out and joining us. This has been fantastic.